At this point, I'm going to hand off to Dr. Stephanie Silvera for the next session, which will be focused on the intersection of structural racism and obesity. Thank you once again, Kamara. And Stephanie, here you go.
Thank you.
Thank you so much, Dr. Jones, for that amazing introduction. And I think it feeds so nicely into the next part that we're going to be talking about. So I'm just going to open up my slides here. Right. So in this session, we're going to be talking about the intersection of structural racism on obesity. I have no relationships to disclose. As Dr. Jones noted, racism provides the social and institutional framework for how we live, how we eat, and ultimately how we die. And I often like to look at this or think about this as an iceberg, right? Most of the work that we do in terms of addressing racism chips away at the top of the iceberg, where we feel good. It feels like we're doing a lot of work, but we don't get down deep to the part that lies beneath the water, which is ultimately the most dangerous piece. And so when I look at these issues of structural inequality, I'm looking at it through two lenses. Large P policy, right? Those broad federal, state, local laws that may or may not be specifically about health. These include things like voting rights, housing, education, and yes, healthcare. But also the small P policies, right? Those organizational policies and practices that have an influence on how we behave, but also influence large P policy through things like funding and availability and enforcement or attention or equitable application of policies or not. And so in this session, we're going to talk about how did we get here, right? What is the history of institutionalized racism and housing and education, and how did that influence how we behave and what we have access to? And when we're talking about this from a historical context, we tend to think of things in these black and white pictures. When we look at the red line maps that are now almost 100 years old, and we overlay them with the racial demographic distribution today, these inequities, these segregation persists, not only in where we live, but is also in our education system and how highly segregated our education system continues to be. And so why does this matter? Why does this matter in the context of obesity? Well, for decades, low-income communities of color have suffered as grocery stores and fresh, affordable food has disappeared from their neighborhoods. And systematic reviews have consistently shown that uneven geographic access to supermarkets in urban areas vary according to income, race, and more often than not, both. And one such finding is that predominantly Black zip codes have about half the number of chain grocery stores compared to predominantly white zip codes, and predominantly Latinx areas have only a third as many. And so when we think about this and we think about the interconnectedness, when we think about the impact that housing has on our socioeconomic resources and how that has an influence on our education and our occupation and how each of those influence our health, this is not only working at an individual level, but at a generational level. So the resources that we're born into are going to have an impact on what our health at birth, which has an impact on our health throughout our lifespan, but that also has an impact on our educational attainment and our income all the way through. So these are a number of interconnected systems that influence, again, how we live, how we eat, and ultimately how we die. And so I'm really excited to have with us two outstanding speakers who are going to talk to us about this history and the impact of housing, racism on housing and education.